Do you ever get that sharp, shooting pain that starts in your lower back and travels all the way down your leg? Is it so intense that it makes just getting through the day feel like a battle? If you're nodding your head right now, you might be dealing with sciatica. But what exactly is it? Why does it happen? And how can you truly understand the root cause of this incredibly common, yet debilitating pain? Well, today, we're going on a journey. Using stunning AI 3D anatomy, we are going to dive deep inside the human spine to see exactly how a tiny issue with a disc can wreak havoc on your entire nervous system. First things first, sciatica isn't a disease in itself. Think of it more as a collection of symptoms. And these symptoms are all caused by one thing: pressure on the longest and thickest nerve in your entire body, the sciatic nerve. Look right here. This incredible nerve originates in your lower lumbar spine, travels through your buttocks, runs down the back of your leg, and extends all the way to your foot. It's a superhighway for nerve signals. When this nerve gets compressed or irritated anywhere along this long path, you don't just feel pain in your back. You can also experience that strange tingling, numbness, or even weakness that radiates down your leg. Now, here's the crucial part. In the vast majority of cases, this compression doesn't just happen out of nowhere. It comes directly from problems within your spinal column. Let's take a closer look. Between each vertebra of your spine, you have these amazing structures called spinal discs. You can think of them as the body's natural shock absorbers. They cushion the bones and give your back its incredible flexibility. Thanks to these discs, we can jump, run, twist, and bend without our vertebrae grinding against each other. Let's zoom in with our 3D model. You'll see that each disc is made of two main parts. The outside is a tough, fibrous ring called the annulus fibrosus. It's like a radial tire, designed for strength and containment. Inside that tough ring is a soft, gel-like center called the nucleus pulposus. This gel-like core is what gives the disc its shock-absorbing power. These two parts work together perfectly to keep your spine safe and mobile. But when these discs get damaged, the stage is set for the main problem behind sciatica. So, how does this damage happen? It could be from lifting something heavy the wrong way, a sudden awkward twist, or even just the cumulative effect of years of poor posture. When that happens, the tough outer ring, the annulus fibrosus, can tear or crack. Now remember that soft, gel-like center? With a tear in its container, the nucleus pulposus can start to push out through that crack. This is what doctors call a herniated disc, or sometimes a slipped disc or disc prolapse. And here is the moment it all goes wrong for your sciatic nerve. As you can see in this 3D animation, this bulging gel material can press directly onto the sciatic nerve root as it exits the spine. It's a direct physical compression, and that pressure is what generates that all-too-familiar electric shock-like sensation that travels from your back, through your buttock, and down your leg. It's a literal pinch on the nerve. But the problem doesn't stop with just pain. This constant compression also inflames the nerve, which can disrupt its blood supply. Think of it like stepping on a garden hose. The flow is restricted. For a nerve, this lack of blood flow and oxygen is what causes those secondary symptoms, like the tingling, the pins and needles sensation, or the frightening numbness you might feel in your leg or foot. Your nerve is essentially crying out for help because it's being starved of what it needs to function properly. Let's quickly recap the common symptoms of sciatica so you can identify them. First, a sharp, burning, or aching pain, usually felt on just one side of your lower back or buttock. Second, and this is the classic sign, is pain that radiates down the back of the leg, often going below the knee and sometimes reaching all the way to your foot and toes. Third, you might experience feelings of numbness, weakness, or that pins and needles sensation anywhere along that nerve pathway in your leg or foot. Now, I need to share an urgent warning. If you ever suddenly lose control of your bladder or bowels, or if you experience rapidly increasing weakness or numbness in both legs, this could be a sign of a rare but serious emergency condition called cauda equina syndrome. This requires immediate medical attention. Do not wait. Go straight to the nearest emergency room. For most people with mild sciatica, you can start to manage the symptoms at home. Focusing on maintaining correct posture, going for gentle walks to keep things moving, and performing targeted light stretching can be very beneficial. However, if these simple home methods aren't providing relief after a week or two, or if the pain is severe, it's critical to consult a professional, like a physiotherapist or an orthopedic specialist. They can accurately diagnose the cause and recommend a treatment plan. For many people, this could involve things like physical therapy, anti-inflammatory injections, or in some cases, a minor surgery to relieve the pressure on the nerve. The most important thing to remember is that seeking help and starting treatment in the early stages gives you the best chance for the disc damage to heal properly and prevent the pain from becoming a chronic, long-term issue. Don't just try to tough it out. We really hope this 3D deep dive has helped you visualize and understand the real cause behind your back and leg pain. Knowledge is the first step toward recovery. In our very next video, we are going to show you the top 5 stretches that are proven to help relieve sciatica pain, demonstrated with clear, easy-to-follow instructions. You won't want to miss that crucial follow-up. Make sure to hit that subscribe button and turn on notifications so you'll be the first to see it. Thanks for watching, and we'll see you in the next video.